Hello, my friends. If you're in your 60s, 70s or beyond, you've likely heard about the risks of heart disease. Maybe from your doctor, a family member, or even a friend who had a scare. One common suggestion: take a low-dose aspirin every day. But is it really that simple? Today, I want to walk you through what aspirin actually does in the body, especially when it comes to your arteries, those important blood vessels that keep everything flowing. Can aspirin help unclog them? What does the science say? And most importantly, is it right for you? This isn't about selling a miracle cure. It's about understanding your heart health better so you can make informed decisions. Because when we know more, we can take better care of ourselves, gently, wisely, and with purpose. Let's begin. Let's take a closer look at what's actually going on inside our bodies. Arteries are the blood vessels that carry oxygen-rich blood from the heart to the rest of the body. When we're young, they're smooth and flexible like clean water pipes. But over the years, substances like cholesterol, fat, and calcium can start building up along the artery walls. This buildup is called plaque. When too much plaque collects, the arteries begin to narrow and stiffen, a condition known as atherosclerosis. This makes it harder for blood to flow freely. Imagine trying to water your garden with a hose that's full of debris. Not much gets through. Clogged arteries can be dangerous, especially if the blockage happens in the heart or brain. That's when heart attacks or strokes can occur. The soon tricky part? You might not feel anything until something serious happens. That's why keeping our arteries healthy and learning how medications like aspirin may help is so important, especially as we age. Now that we understand what's happening inside the arteries, let's talk about how aspirin works in the body and what it really does. You've probably taken aspirin for a headache or arthritis pain, but did you know it also affects your blood? Here's how it works. Our blood contains tiny cells called platelets. When you get a cut or injury, these platelets clump together to form a clot and stop the bleeding. That's a good thing on the outside of the body, but inside the arteries, clotting can be dangerous, especially if there's already plaque buildup. A clot can form right on top of a plaque deposit and block the flow of blood completely. That's how heart attacks and strokes often happen. Aspirin helps by making the platelets less sticky. It doesn't thin your blood exactly, but it does make it less likely to form a harmful clot. That's why doctors sometimes recommend low-dose aspirin, especially for people who already have heart disease or are at higher risk. It's a simple, little pill, but it can make a big difference if it's used correctly and safely. But can aspirin actually unclog arteries? Let's explore that idea next and clear up a few common myths. Let's clear something up that often causes confusion. Many people think aspirin can melt away plaque or clean out clogged arteries like a drain cleaner. But that's not how it works. Aspirin doesn't remove plaque. It doesn't scrape it off the artery walls or make it disappear. What it does do is help prevent something even more dangerous: a blood clot forming on top of that plaque. You see, most heart attacks and strokes don't happen just because of plaque alone. They happen when a piece of plaque ruptures and your body reacts by forming a clot. That clot can block the artery completely, cutting off blood flow to the heart or brain. Aspirin helps lower the risk of that clot forming in the first place. So while it doesn't unclog the artery, it helps keep things flowing by reducing the chance of a sudden blockage. Think of it like this. If plaque is like a traffic jam, a blood clot is like a full roadblock. Aspirin helps prevent that roadblock from shutting things down. That's why, in the right situations, daily low-dose aspirin can help people with certain heart risks avoid major health events. But timing, dosage, and individual health factors all matter. Next, I'll share my personal routine with aspirin and why it starts with a conversation with my doctor. Now, I want to be clear. I'm not giving medical advice, but I'll share how I personally use aspirin and how I came to that decision with the help of my doctor. For me, I take a low-dose aspirin, just 81 milligrams once a day. That's often called a baby aspirin, even though it's not for babies at all. It's enough to help with clot prevention without being too strong. I take it in the evening, usually with a light snack. Why the evening? Some studies suggest that heart attacks are more likely in the early morning, so having aspirin already in the system overnight might offer better protection. But honestly, what matters most is choosing a time you'll remember every day. Before I started this routine, my doctor looked at my full health picture, my cholesterol, blood pressure, family history, and whether I'd had any heart issues before. Together, we decided aspirin was a smart step for prevention. It's also important to never stop aspirin suddenly, especially if you've been on it for a while. That too should be done under medical guidance. And I always watch for any signs of side effects, like stomach irritation or unusual bruising, and I keep my doctor informed. Aspirin may be common, but that doesn't mean it's casual. Used wisely, it can be part of a thoughtful heart health plan. Now, this part is just as important as everything we've talked about so far. Aspirin isn't safe for everyone. For some people, the risks can actually outweigh the benefits, especially if you've never had a heart attack, stroke, or major heart issue. Why? Because aspirin can increase the chance of internal bleeding, especially in the stomach or intestines. It can also cause irritation to the stomach lining, and if you're already taking blood thinners or anti-inflammatory drugs, the risk goes up. That's why doctors today are more careful about recommending daily aspirin than they used to be. For many older adults, especially those without a history of heart disease, it may not be the best choice. If you have a history of ulcers, easy bruising, or bleeding problems, or if you're taking other medications, it's essential to talk to your doctor before starting aspirin on your own. So remember, just because aspirin is over the counter doesn't mean it's harmless. It's a powerful medicine, and it needs to be part of a thoughtful, personalized plan. Whether or not aspirin is part of your routine, there are other gentle, natural ways to help keep your arteries healthy, and they don't require a prescription. For starters, I focus on movement. Every day, I try to go for a walk, even just 20 minutes around the block. It gets the blood flowing, helps lower blood pressure, and boosts my mood. Movement truly is medicine. Next is what I eat. I've added more heart-friendly foods like fatty fish, like salmon, twice a week, a handful of nuts, unsalted almonds or walnuts, fresh vegetables, especially leafy greens, olive oil instead of butter or margarine. I also cut back on processed foods and too much salt, which can stiffen the arteries over time. And here's something people don't talk about enough: joy and calm. Chronic stress raises inflammation in the body, and that affects the heart too. So I make time for what I enjoy: music, reading, a phone call with an old friend. Aspirin can help in some cases, but daily habits are what truly protect us in the long run. So, can aspirin unclog arteries? Not exactly. But it can play an important role in preventing clots, especially if you already have some plaque build up. The key is knowing your personal risk. Talk to your doctor. Ask if low-dose aspirin is right for you based on your health history. Don't guess and don't go it alone. Also remember, no pill, not even aspirin, can take the place of healthy daily habits. Eat well, move your body, and care for your mind and spirit. It's all connected. If you take just one step today, let it be this: learn more about your heart health. You've made it this far in life, and your heart has been with you every step of the way. It deserves your attention, your care, and your kindness. If you found this helpful, I invite you to subscribe to Timeless Wisdom for more heart-smart tips, uplifting health advice, and real-life tools to help you feel your best, no matter your age. Your journey matters, and so does your story. Let's keep learning and growing together. Have you ever talked to your doctor about taking aspirin for your heart? Share your thoughts in the comments. Your experience might help someone else make a wise decision too. Take care, and I'll see you in the next video.